How is everyone?
Great.
Good. Glad to hear it. As Mark mentioned, I am very deeply involved in a lot of different levels. Sometimes they call them cylinders of excellence or other names. I call them silos of stupidity, because really it's a holistic issue that we're dealing with, and it's a tar baby. It's mental health, it's addiction, it's homelessness, it's incarceration. And so you have all of these different factors, and we have a population that circulates through the revolving door on a regular basis. And one of the definitions of mental illness is doing the same thing over and over again and expecting a different result. So we're doing it wrong, and it's very obvious to a lot of people, but we're still at the point where there's an awful lot of those silos, and we have to break them down. And we've got another crisis right on top of that, which is the fentanyl crisis. So I'll speak to that as well, because it's all mixed in, and it is now getting to the point where it's an epidemic. So this is happening in families, it's happening on the street, it's happening in offices and 7-Elevens and McDonald's, all over the place. So we're seeing a huge increase in fatalities from overdoses. Almost all of that is related to fentanyl. So we'll be talking about that as well. So let's go back. Back 2,000 years ago, does everyone know the story of the Gerasene demoniac? That was the guy, when Jesus crossed the Sea of Galilee, who was in chains in the cemetery. And he was screaming and possessed by demons. Now, I've talked with theologians about this, and there is that mental health component to it, okay? There are demons. They do possess people. But to have an exorcism, the Catholic Church actually has to have several psychologists and psychiatrists examine someone before they'll even go to that step. They want to make very sure of what it is. It's not something to fool around with. And we all know that Satan walks the earth. So with the Gerasene demoniac, Jesus touched him, and all of the demons flew out into the pigs that ran over the cliff. Now, had someone had 5,000 pigs in Israel, a Jewish country, 2,000 years ago, I'm not quite certain, but nevertheless, it's something that we have to think about. So you had the Gerasene demoniac. Jesus cast out demons time and time again. So we know that these illnesses go back at least 2,000 years. They found skulls with trepanning, where basically they've drilled into the skull. This is 5,000 years ago now, where they drilled into the skull to relieve pressure or do something. We don't know. We do know that that helps with brain injuries. So we do know some of these things occur. So the brain is central to our existence. And we can talk all we want about artificial intelligence. Real intelligence is always going to be in the forefront. But the problem is the brain is the most complicated computer you can imagine. We have emotions. We have logic, we have the brain, the very, what they call the lizard brain, and then you have the cerebral cortex. And all of this is mixed up with a bunch of chemicals that can go awry, or psychological issues can affect someone and drive them over the edge. I'll give you an example. My grandmother was a RN. She immigrated from Ireland in 1913. And she ended up working as the chief psychiatric nurse at Kings County Hospital in Brooklyn, New York. She was very competent at what she did. She retired a few years later to have a family, which is what you did back in that day. So she had 5 kids. She had a husband. Her husband was an alcoholic. He was a plumber who basically built stills in the 1920s for the mob. And he liked his alcohol. And he was a very nice man, but he would disappear when he got paid for weeks at a time, and the family would be destitute, and they'd get thrown out onto the street because they couldn't pay the rent. This happened one too many times with my grandmother back around 1934 or so, and she went over the edge. They called it a nervous breakdown at the time. We call it a psychotic episode. And she never came back. She went from being a very competent, very wise, very hardworking mother to thinking that she was a 16-year-old Irish girl speaking Gaelic. And so she ended up at a place called Creedmoor, and she was there for 35 years. And they kicked her out. My uncle got a call one day, back around 1970, and he was told, either you come up and pick up your mom, or we're going to put her out on the street. And that was when we had the homeless crisis. There was a guy named Dr. Thomas Zaz, who was very anti-psychiatry. And he wrote a lot of books, and he was very famous, and he was on the talk shows of the time, and we only had 3 networks, plus then PBS came along. So he was very popular, and he argued for human autonomy, okay? Unfortunately, the fact is that we have our own autonomy, but we also have to have some guardrails sometimes. So those guardrails are instilled in us in school and by family, but when mental illness occurs, you don't have those guardrails anymore. And so those people end up on the street, and you've seen them at the freeway on-ramps, you've seen them on the street. I live in Anaheim, and so I see it every day. And you realize that between addiction and mental illness, we have a huge problem. And the homeless crisis was one of the real sparks for that, because we used to have places for people who needed help. I had a stepson who died in 2014 by suicide. He had severe mental illness, he had addiction. He got picked up in the middle of Nagel Park down in South County, and he was in a catatonic state. And he had been in and out of institutions all of his life. He was 25 years old at the time. And he had very severe mental illness. He was scary. I did not have a good relationship with him. I tried, but it's very difficult. And with families, that's what you're always facing, is you have to have a huge amount of compassion because they don't act logically. So they picked him up, took him over to Mission in Mission Viejo. Mission doesn't have a psych unit. They moved him over to UCI, which has an 85-bed psych unit, and had him for 10 days. His mother was very specific because we'd been through this mill multiple times. And she said, don't put him on Haldol. It's the worst thing you can do. Guess what they did? They gave him a maximum dose of Haldol, because Haldol is a drug that basically creates zombies. So all of a sudden you lose your emotions, you lose your feelings, you're dead to the world. And she suggested what he was usually using when he did take his meds, which was Risperdal, which was another antipsychotic. And so here he was. They'd given him something that he knew was going to set him off. And he acted out. He was put in seclusion. Believe me, seclusion in a mental institution is not something you want to see. They spread eagle you on the bed and they lock you down. And it's a horrible thing to do to any human being. But that's what they did. He came out of the hospital. They gave him a bus pass and his clothes on his back. He took the bus over to UCI, main campus, jumped from a parking structure. It was on the front page of the Register. So this is what you're dealing with. You're dealing with a little girl or an old woman who thinks she's a 16-year-old Irish girl on the one hand, and you're dealing with a kid who lived on the streets for years, who finally went over the edge. And so I was watching all this, and I said, there's got to be a better way. And so that's when I started getting involved. I could see my stepson, falling down, and so I started getting involved. And just about that time, Bishop Van and Rick Warren and Kay got together and had something called the Conference on the Church and Mental Health. And they had 3,000 people attend from all over the country, some of the best speakers in the world on mental health. And so that really kicked off the diocesan effort to have mental health care at the top of the list for pastors, for ministers within the church. We now have about a dozen of our parishes that have mental health ministries. I'm down at Queen of Angels, so we have an inactive ministry because of COVID. We did a lot of programs, we've had a lot of speakers and things like that, which we couldn't have for 2.5 or 3 years. So we've got to get that back up and running again. But at the same time, we can refer people to Catholic clinicians. We talk to each other. I don't know, does anybody know what NAMI is, the National Alliance on Mental Illness? NAMI is a volunteer organization, of which I'm a member, and NAMI has a class called Family to Family to teach family members how to care for their family member. And so it's one of the most useful tools for families, and I just started teaching last week, and I teach again on Friday, and it's a 12-week course, so it's very in-depth. And we teach families how to deal with their family member. We teach them how to deal with the stress involved. We teach them about the drugs and the pharmacology a little bit. We don't go real deep, but you should at least know what your family member's on and what happens when he's on and when they're not on. Because if you can keep someone in recovery, they're going to stay in recovery. And that's the huge win for all of us. And that's really where we have to get at the end of the day. But NAMI started getting involved in a lot of this stuff, and they've been teaching this course for 25 or 30 years now, and it works. We know it works. There's been studies done on it. So all of these different things were starting to really pop up, and we had a opportunity over at the Fairview campus in Costa Mesa, which is owned by the state, which was a developmental hospital, to look at that. And it got into the politics. And I wrote a proposal in 2016 to take that campus and turn it into a wraparound mental health facility. So it didn't matter if you just were going to your appointments, your doctor would be there, all the services would be there, all the way from crisis to permanent supportive housing and services. Well, that set a lot of people thinking. And so a lot of us got together and we started talking about collaboration. And one thing that's not done very well here in Orange County is collaboration. We just don't do it very well. People are very independent, but we need it. We desperately need this. And so we started out with this Be Well Coalition. I don't know if you know what that is, but the Be Well Coalition brought the hospitals in, it brought the county behavioral health agency in, it brought Cal Optima, which is the Medi-Cal provider for Orange County in. It brought all of these stakeholders in, and we had all these great conversations. But the big issue that was facing the establishment, if you will, was the cost of emergency services, the cost of homelessness. All of this started raising its head, and it was all front page news. But the real issue was that people were clogging our emergency rooms and not getting any help. So you would bring your child in there in the middle of a psychotic episode, or they had a suicide attempt or whatever it might have been, and they go in, and there's a police officer who usually brings them in, and they sit down, put them on a bed, handcuff them to the bed in a lot of cases, and then they sit, and they can sit for days until a bed opens up. So they're not getting any help, they're not seeing a psychiatrist, they're just sitting. And that does no good for anybody. An emergency room bed costs $3,500 a day. It's very expensive. So we gotta work on that. In the hospitals, it's a huge loss leader for the hospitals, so they just don't want to have anything to do with it. So what happened was this Be Well Coalition, which was bringing in the church, it was bringing in businesses, it was bringing in an awful lot of people who had never been involved before. It became a vehicle for the county behavioral health agency and the hospitals to basically build bricks and mortar up in Orange, at the junction of the 57 and the 5. I don't know if you've ever seen the Be Well campus there. If you're coming down the 57, there's a big sign that shows on the side of the building. Otherwise, it might not be noticed. But it became basically a crisis stabilization unit with a sobering station, which we used to call the drunk tank, and with a few beds. But the problem is we need a lot of beds. And you need the beds at each level, because when someone's going through crisis, they're going to need a hospital setting. Then you step it down. Or someone's committed a felony, someone's committed a murder. They go up to Atascadero, they go out to Patton, they go up to Napa, all the state mental hospitals. 98% of those people in those mental hospitals are forensic. They're basically there because of court orders or because of felonies. And they're being assessed for trial or just kept there against their will because it's an alternative to prison. It's just really another form of incarceration, if you will. So we don't have enough of those beds either. And then you have the step-down beds, because when you get someone into recovery, they start taking their meds, they come down, they start acting rationally, and if they stay on their meds, that's a great thing. But we also have an awful lot of people who are like my stepson, who will never get well. So you do have that minority that you have to have beds for. So you have to have all these levels of beds, but we're not thinking like that yet. We have to start thinking holistically. We have to start thinking about how do we put it all together so that we really get to the ultimate goal, which is either getting someone into supported living or back to their families. Because one of the things that happens with an awful lot of these people, what happened in my family for sure, was they can't stay home. I mean, they're using, they're violent, they're stealing, they're doing all sorts of things, and then they break their ties with their family. And a lot of those ties are never reformed. But we have to get to that point. And it all comes down to treating the individual at the center of the crisis rather than as a patient. We always have this top-down look from a doctor, from a nurse, from an administrator, of having them come in to a hospital or into a clinic or to a doctor's office, when we really need to meet people where they are. Because if you do that, if you start with the individual and meet them on the street, that's when you start healing. And there's the former head of the LA Department of Mental Health, Dr. John Sharon, was actually doing that with some of the worst cases in Hollywood. So he would go out a couple of times a week in the morning and sit down with these people on the curb and just start talking. And there's that human connection as well, because an awful lot of these people are very, very isolated. They even form their own communities. So when you see the homeless encampments, that's actually a community of its own. So all of these things boil down to putting the individual first, getting to them early on, and then staying with them and walking with them. That's where you guys come in. Because if you know someone, don't be afraid. It's something you can learn about. It's something that you can act on. And an awful lot of it is just basic human compassion. So there's that, okay? Now, we've made a lot of progress because of this Be Well coalition. A lot of people are talking to each other. We're seeing a lot with the Orange County Department of Education trying to put counselors into the schools. We didn't have money for a lot of this stuff before, but it's been raining manna for the past 3 years because of COVID. I mean, it is just coming down, and I'm the immediate past chair of the Behavioral Health Board here in the county. And basically, when I started getting involved in 2015, 2014, there was a budget of about $110 million from what they call the Mental Health Services Act. Mental Health Services Act is a 1% millionaire's tax. And I don't know if any of you folks who are making $1 million a year, but if you are, you're paying 1% of your income into that fund, which goes strictly to behavioral health. So thank God for that. We were getting $100 million a year. Next year, it's going to be $300 million. And to an extent, they don't even know what to do with it, because they keep on having these surpluses, And it's planned spending, it's yearly allocations for different things. There's a lot of different reasons for it. But nevertheless, that budget has tripled here in Orange County. And that budget, that MHSA money, pays for all of the outreach services, all the prevention, all of the crisis services. If you have a family member in a full service partnership, I don't know if you know what that is. That's basically a day program for individuals with mental illnesses. It pays for that. It pays for the crisis assessment teams. It pays for a lot of programs in a lot of different needs. And it's all for the county-based clientele. So a lot of it is Medi-Cal, a lot of it is people with no insurance whatsoever. So it doesn't include all the private pay, and the people who get left out in that, by the way, are the middle class. So we got to go out and pay our bills. We got to go pay $300 an hour for a psychiatrist or whatever it may be. And it gets expensive. And insurance pays for a lot of that, but for a lot of mental health, it does not. So we really need a public health model that basically treats everyone and treats them equally. So we're working on it. We're trying. But a lot of people are trying to get it at the root cause. And it's much better. There's a story, and it's, I don't know where it came from, but it was of a man who was fishing on the side of a river. And he sees a child in the river floating by. And there's a waterfall, and he knows that child's going to die. And then he sees another one, and another one. And so he calls to his friends and says, we have to go get these kids out of the river. And his friends start a chain, and they start taking these children out of the river. And then he leaves, and they ask him, where are you going? I'm going upstream. And so that's what we want to do. We have to get them when they're kids. We have to get them at a point where the psychosis itself, with something like schizophrenia, continually degrades the individual as they have episodes, okay? This isn't true with bipolar disorder. This isn't true with depression. But with schizophrenia, every relapse, you lose a little bit of functionality. So if we get them early, then we can really arrest it at a certain stage so that they can maintain their best possible version of themselves. And that's really where we want to be. So that's where the schools are trying to get involved. You're going to see a lot more being done in the schools. You're going to see a lot more being done in the community for young people, because it all starts going off the rails. Like with me, when I was about 12 years old, I started experimenting. Cigarettes, beer, all of those different things. Well, for some people with an addictive gene, and a lot of it is genetic, it's the path down a slippery slope. So you have that, and you want to try and arrest that early. We had Just Say No. That didn't work out real well. It did for a while, but it didn't. At one point, it got old, and you have to keep on refreshing these things. So we have to find modalities to be able to get to kids at those ages. And here we have a situation in our country right now where they're trying to tell kids that if you're born male, you can be female. If you're born female, you can be male. Well, one of the biggest mental health crises is within the transgender community. Imagine having your human sexuality at the root cause of your illness. I mean, that's who we are. That's who we are as human beings. So we're fostering that now. And we're fostering, to an extent, an increase in mental illness because we're not taking drugs seriously. We're not taking individual behavior seriously. We're all saying it's somebody else's fault. It's the internet. It's whatever. Those are all triggers. But we have to build resilience within our young people. So that's a big part of it as well. Now let's get on to the other side of it, which is the addiction side. So you have a lot of people with mental illness. Mental illness, an awful lot of that addiction is self-medication. So you feel much better when you're high than you do when you're your dreary old self, and that goes across the board. So an awful lot of people drink to get high, they do drugs to get high. And at a certain point then, it becomes an addiction. It can happen after the first episode, it can happen after 100, it can happen, so that you're a raging alcoholic who can't function anymore. So you have that, and then you have a microcosm of that in our homeless population. Now, one of the interesting things, we all talk about the sober living houses. You've seen it in the register, you've seen it in a lot of the news. One of the problems is perception. Because one of the realities with sober living is, yes, those are people with addiction, okay? But they're trying to live in a sober manner. They're trying to live in sober lives. They're there to support each other in those sober living homes. Now, it doesn't work out that way because addiction's a very nasty disease, and it is a disease. It is a brain dysfunction. It's a brain malfunction. Mental illness is a biological disease. There's something going on in the chemistry in your brain there. So there's a lot of that. There's a psychological aspect, and there's also the spiritual aspect as well. So an awful lot of these individuals who are trying to stay sober in those sober living houses are being basically ostracized and marginalized. And we have to figure out a way, because I was a part owner of a sober living company for a while. And what I saw was that the neighbor next door could be dealing drugs to the people in the house. Or they're getting high and you can smell the weed, which is not a good place to be when you're trying to live in a sober manner. So we got to look at that, and we got to really try and empathize as best we can with those individuals. So these are all part of it. But when you look at the population, Orange County happens to have the largest footprint of addiction treatment in the country. So we have over 300 private organizations that treat alcoholism and addiction. Then you have the county and public side, which is much more restricted. The private side is about 65% of the total dollars spent on behavioral health. And then the public sector is about 35%. So that you have to have that balance. And by the way, there's a great big wall between them too. So as an example, your kid could go into UCI or College Hospital, which is a psychiatric hospital in Costa Mesa, and they may get treated in that place, but that information does not travel with them. So you could go to UCI and get a diagnosis of schizophrenia. You go to another hospital, another doctor's going to tell you it's schizoaffective disorder, or it's bipolar disorder, and they'll give you the different medicines for doing that. And so it's really a crapshoot, and you have to really trust the doctor and see what works. Like I said, with our son, we knew one drug worked, we knew the other one was the worst thing possible. So those records do not travel with the individual. So what happened over here, these guys don't know anything about it. And the families in a lot of cases are shut out. So there's a law called HIPAA. It's a privacy law. And so you may not know that your family member has a mental illness or that they're being treated in a certain manner. They have to allow you to know that that's happening. But once you engage the family, and an awful lot of it comes right back down to the family, that's when you see more positive results. They did a study, and there's been a couple of others, of family education in behavioral health. And if you educate the family, you can reduce hospitalizations by 85%. It's a huge win, and we gotta really get there. And that's what this organization, NAMI, tries to do, is educate the families. We also have programs for individuals, we have programs for providers. Believe me, having been in most of the psych units here in Orange County with our children, you see an awful lot of people with indifference. You see an awful lot of people who don't like what they're doing. A lot of people who don't treat people humanely. and you have to educate them. And I did a class a couple of years ago now down at Mission in Laguna Beach, and there were a couple of nurses in the class. This was a provider class, and they were just, they were texting, whatever, not paying any attention. You could see the bad nurses. And I really shook them up. I said, this is totally unacceptable. You're dealing with people at the very bottom of their self-image. You're dealing with people at the very bottom of their health, and yet you're not offering them the one thing they need most, which is human connection. They need their meds, they need to be kept safe, but they also need to be brought back up again, and that's where Helping Hand comes out. So we now also have a fentanyl crisis. And about 5 years ago, we started seeing this, 7 years ago, we started seeing this on the East Coast. And fentanyl is what they call an analog. It's a synthetic opioid. So it's in the same class as heroin, methadone, what's the other one? Oxycodone. All of these different drugs are opioids. And fentanyl is synthetic. It is 50 times more powerful than morphine. It's about 30 or 40 times more powerful than heroin. And the perverse reality is that a lot of people are seeking fentanyl out because it gives them a higher high. The high doesn't last nearly as long as a heroin high, but they're going for the high. And it's dirt cheap. It's coming in raw materials from China. We know where it's coming from. And then they're mixing it down in Mexico. And the beauty for the cartels is that they can now take a 55-gallon drum or a bag that big and stash it in a car somewhere, 55-gallon drum, in a truck or whatever, and get enough doses to kill the entire United States across the border in one shot. 2 weeks ago, there was a seizure in San Clemente at the Border Patrol station of 232 pounds of fentanyl. They said that was enough to kill 50 million Americans. Now, how they come up with those numbers and how this all gets through, I have no idea, because a fentanyl high is very cheap, and I guess they're making it up in volume, but they don't have the poppy fields to worry about and the growers and all of that to worry about anymore. So it's a very inexpensive product, it's very portable, and it's very deadly. So back in 1975, I went to Fordham University in New York City, and I lived right up the street from campus, and there was a place called Needle Park. There was a movie made about it with Al Pacino. It was his first big movie called The Panic in Needle Park. That was 1973, New York City. 1973, overdose deaths in the United States were 6,000. 2021, overdose deaths are 108,000. So it has skyrocketed. We have lost the war on drugs. So what do we do? I mean, it's running rampant, and COVID did not help. A lot of people decided, hey, I'll stay at home, I'll just get high. And you can get it delivered. You can order it on a lot of these Snapchat and TikTok and things like that. They'll deliver. They're more reliable than the pizza guy. So, it's happening in parking lots now. It's happening in McDonald's. It's happening in college dormitories. It's happening in homes. It's happening all over the place. Now, the highest number of deaths is still among the homeless, because that's where your highest number of people with addiction is. So we're working on that. And there's an antidote called Narcan. And I don't know if you've ever heard it. Naloxone is the generic name. And it is an inhalant or a injectable. Usually these days it's the inhalant that's available. And it's available for free, by the way, in a lot of places. So I actually usually carry it around with me and just hand it out to people and train them. It takes about 5 minutes to train someone on this stuff. It's a shot in one nostril, you wait 2 minutes, and you give a shot in the other nostril. And so you wait about 5 more minutes if they're not responding. And sometimes, the first thing that it does, the way fentanyl kills you, is basically that it stops your breathing. So you stop breathing. And from that point onwards, it's 5 minutes until brain death. That's how quickly this acts. So they used to have what they call the golden hour. You know, someone could be revived within that hour, they could make a full recovery. You don't have that margin with fentanyl. You got to have it on the spot. You got to be right there with them, and you cannot be afraid to use it, okay? Narcan, it's the most easiest thing in the world, and basically it saves lives. And the state distributes it for free. So you can get it at a pharmacy. It'll cost you about $125. They're starting to work on better distribution. This is one of the big things that I've been advocating for now for the past couple of years, is I want to see it at gas stations, 7-Elevens, McDonald's, hotels and motels, all of these different places where people might use. Concerts. I went to a concert, and I'm dating myself. It was the Grateful Dead last June, okay? So I took my kids, all of us went up and saw the band. We're sitting there having a great time, rocking out, and some guy right in front of us just plunges over, flat on his face, dead to the world. It was an overdose. It took him 15 minutes to get there, to get the gurney there. There were a couple of people working on him. I don't think anyone had Narcan. I had it out in my truck. Didn't do a lot of good there, but I just don't know whether this guy survived or not. But this is where it happens. It happens in real life. So when you see that, you have to be ready to respond, and that's where you all come in. So if you can get you can get Narcan, then carry it around with you. Most of our cops carry it now. Our firefighters carry it. I was talking to an Anaheim cop purely by accident. Didn't get pulled over. But I was talking to an Anaheim cop yesterday morning. And Anaheim has a big problem. That's where most of the deaths in Orange County are. Anaheim, Santa Ana, Huntington Beach, Garden Grove. Those are the 4 cities where the highest number of overdoses happen. So it's the homeless population. But now, because they've gotten a lot of Narcan into that population, this officer told me yesterday morning that a lot of times the Narcan's already been used by another homeless person to get that person revived. So it is having its effect, but we're still losing way, way too many people. Yes, sir.
I have a question. So how are people taking this drug? Is it a pill?
It could be pills. There are basically 3 different ways. Injectables, which is not very popular. Smoking it has become very popular. It's a very quick high.
How do they smoke it? Cigarette?
No, what they'll do is you know what a crack pipe is, right?
No.
It's a little glass pipe. You could use other things. You can use a piece of aluminum. I won't tell you how I know that back during my college days. But basically, you know, you can smoke it in a lot of different ways. It's a powder. But there's an awful lot of pills that are out there now. There's an awful lot of counterfeit pills. So if you think you're buying oxycodone, it's not oxycodone. If you think you're buying benzos, which are very popular as well, it's not benzos. If you think you're buying meth, that meth may well be cut with fentanyl. So it's getting into a lot of different things, and people usually smoke meth. So, yes, sir.
Yeah, a couple of months ago, I was at the Board of Supervisors, and Sheriff Barnes and Todd Spitzer are talking about getting it into the school. In fact, they just announced the program where they're getting it into the schools. But your story is important. The question I got is, what can we do? Obviously, getting armed with Narcan's a good way.
Mm-hmm.
But what other things do you think we should be doing to help?
CPR.
What's that?
CPR. I mean, what happens is the heart stops. They need oxygen. So the only way to get oxygen into someone is CPR. And I hate to say mouth to mouth, but we got to get back to that with these cases. We don't have that danger of HIV/AIDS anymore. That has largely receded. So we have to start thinking along those lines. When you're in a crisis, you have to act immediately. It's first aid. So, you know, you really have to get the CPR going. You have to try and, I mean, with heroin, they used to try and get people walking and moving to breathe so that they would keep them alive. That's not done as much anymore. But having that 5-minute window is a crucial window. And so we really have to, each of us, be able to understand and not be afraid. A lot of people just freeze up. So.
That's the COVID expression, if you will.
Well, COVID, I mean, just about everybody's had COVID now.
Yeah.
So we've all had it. It's going to be like the flu. It's going to be like a bad cold, whatever it may be. There are going to be people at risk, or elderly, or people who are compromised. That's always going to be there. But we have to not be afraid. And what did Christ tell us? Be not afraid. So all of these different things as a community are very important, because it can happen anywhere. You may be on a street corner, you may be walking down, you may just see someone sprawled on the street. See if they're okay. It's a really simple thing to do. But even in people's homes, what's happening, our kids are doing this, and they'll take a pill and they'll go to bed and they'll never wake up. And that has happened time and time and time again. And so it's a matter of public education, and that's where this whole systemic change has to occur. So we really have to work on caring for each other, knowing the signs of mental illnesses, knowing the signs of addiction and overdose, and then there have to be resources at the end of the line. One of the things the county does really well is linkages. But if there's not someone at the end of that line for that individual who is going to actually provide service, so whether it's a therapist, whether it's a psychiatrist, whether it's someone who can prescribe medications, all of that has to be in place. There has to be a bed available every time someone says, I'm ready to go sober. There has to be a bed available. A lot of times there's not. Or it's very expensive. I mean, you can spend $30,000 a month on recovery. And, you know, for wealthy people, that's great. But the rest of us don't have that kind of money.
One other question. Have you ever thought of being Patch Adams with that $200 million and buying that facility down in Costa Mesa? You know, in other words, you know, you've got this surplus coming in from the fund.
Well,
Would they go that
it's very specific. So the law is very specific on how that money gets spent. So X amount has to go to what they call crisis services. X amount, 19%, goes to prevention and early intervention. But we have to do a lot more of prevention and early intervention, because that's where the big payoff is. But nevertheless, a lot of it, as an example, we have the Be Well campus that the county did most of the funding on. So we have those beds now. And cops love it, by the way, because the other alternative for police officers is to take them to jail. That's paperwork, that's hours off the street. With the sobering station, they can just drop them off and leave. So the police love it. It's a huge cost saving for law enforcement. But nevertheless, when someone says they need and want treatment, and the light bulb has to want to change. So there's an old joke. How many psychiatrists does it take to change a light bulb? 3. But the light bulb has to want to change. So these are the kind of things that we really need to focus on. The other part of that equation, by the way, is if you have 4 psychiatrists in a room, you'll get 8 diagnoses. So they always argue, you know, it's crazy, if you'll excuse the phrase. Yeah, but you know, they don't agree. Like I said, our son was schizoaffective, he was bipolar, he had schizophrenia. Those are all very separate diagnoses. They're separate diseases. So, you know, there has to be a way. And just yesterday, I read an article from the Journal of the American Medical Association, so it's probably true, but they say that in analyzing lipids, the fats and oils in your body, we all carry around a lot of different kinds of lipids. It's a chemical family. But in analyzing lipids, they can now actually detect differences between people with mental illnesses and people who don't have mental illnesses, and between different illnesses. Now, this is a first step, and it was a very broad step, but it gives us a path forward for research to be able to do clinical diagnoses, because there's a doctor in Costa Mesa named Dr. Daniel Amen, and he does a lot of MRI analysis. He's the guy who did an awful lot of the analysis for the brain injuries with the football players. So you could actually see, when you see the brain on a brain scan, an MRI, of a person with mental illness or a person with traumatic brain injury, you'll see a big dark spot right in the middle of their cerebral cortex. That is a dead zone. So, and it usually doesn't come back. That's the problem. But he was, where was I going with this? But Dr. Amen, yeah, but he does these MRIs, and he made the point that the one part of the body that is not physically examined by a doctor to make a diagnosis is the brain. So we have these different kinds of brain scans that they can do. They tell us a very small part of the picture, but we don't have those tracers. But this lipid chemistry idea is the best one I've seen yet. So it's worth a lot of research, it's worth a lot of digging. So there is a lot of hope there. Now there's one other thing that I'll say, I guess, in closing. I don't know if any of you live in either Newport, Huntington, Garden Grove, or Irvine, but there's this Be Well organization now has vans going out on the street. And a lot of the law enforcement agencies have homeless officers, they have mental health officers now. So they'll go out and they'll do wellness checks. They'll go out and they'll talk to people who are acting out on the street. We had a very bad incident down in San Clemente where a guy tried to grab a cop's gun and he was shot and killed. These were the homeless officers who were doing this, by the way. But you can get into some risky situations, and you have to always protect yourself. That's rule number one, is to protect yourself. But they have these officers who've been doing this. But now what they're doing is they're actually putting mental health clinicians. So they're not RNs, they're not psychiatrists, but they're technicians who can talk to people and sit with them. Because an awful lot of time when someone's in crisis, you can talk them down. So you can just basically calm them down. They don't even have to go to a hospital. They don't have to go to a crisis stabilization unit, which is a 23-hour resting place for people who are in a crisis. So they don't have to go there. And that's another part of the picture, because about 80% of what we can do is that we don't need to get them into the emergency room. So that's really where we want to be. Now there's one last factor, and that is the administration of drugs. So talking to some of these people who work in these vans, they do not dispense medication. So a professional, a nurse practitioner or a MD has to actually write the prescription.
Is that the same thing with Narcan?
Excuse me?
Is that the same thing?
No, Narcan was originally used to revive babies whose mothers were addicted to heroin. So if you can use it on a baby, you can use it on just about anybody. It has no ill effects. Now, the one effect that it does has is send someone into withdrawal immediately. And people who go into withdrawal get pretty ornery. Yeah. So, it's not a pleasant feeling necessarily, but I would much rather have someone ticked off with me than have them dead. So you have to make that judgment. But basically, the one thing they said they're lacking is being able to dispense it, because if you can keep someone on their meds, they're not going to end up back in the hospital. Like I said, family care, keeping on the people on their meds, we're going to see a lot of that crisis dissipate if we do it right. So there's an awful lot of people doing an awful lot of things, but we have to bring them together to be able to really solve the root cause. And like so many illnesses in our society right now, so much of it revolves around the nuclear family. So, here we are, they're doing their best to try and destroy the nuclear family, and yet that's where we know the answers are. So there's something at work there. You can call it Satan, you can call it Marxism, you can call it a lot of different names, but
label whatever it is,
it's whatever it is, it's basically killing us. And so, that's my story, and I'm sticking to it. Are there any other questions?
I have a diagnosis.
In the back first. You had your question.
It seems to me, you brought up that point about, the HIPAA laws, all these different laws about sharing information, but it seems to me that if certain people out there, and they just kind of move around, especially the homeless and the people, is there a database that the government's using? It seems like we're being tracked on everything. Everyone knows everything.
Every county in California is different, okay? We have some very large counties, and we have a lot of really small ones. We have counties with 15,000 people in them, for God's sake. So those are a lot of the ones up in the hills and the mountains up north. So every county has a different way of dealing with it. They used to call them, and I'll use this phrase unwillingly, frequent flyers. We call them high utilizers now. But the hospitals knew who they were because sometimes they're seeing these people on a daily basis. I mean, this is really where a lot of your crisis comes in, and where the clogging in the emergency rooms comes in is the same people coming in over and over and over again. And so it's a revolving door. But we do not have, like I said, portability of records. So even in law enforcement, I mean, they can dig up your criminal record across every agency. So if the FBI wants to know, they plug in your Social Security number, whatever it may be, and they can find out your complete criminal record, as can Santa Ana PD or the Orange County Sheriff or anybody else. But that does not include the medical records. So homelessness, medical records, if you're in the Orange County system of care, they can track you. So there's a lot of different systems, but there's no real way of, having that data with the individual when you need it. And that's part of what we have to work on as well.
Well, mine was similar to that, so I'll let it go, other than the fact that I am a man who was trapped in a woman's body, but my mom hadn't. She finally birthed me. The question is, and add on to what Dan said, is we need to be able to, the portability is both good and bad.
Mm-hmm.
The good because it protects us HIPAA, but at the end of the time, somebody can just go from one end.
Yeah.
At 4 different types of drugs, so is there any movement in that area to maybe middle ground it? So like
That's what we're trying to work on right now.
Yeah.
So there's an awful lot that we can do. There's something called a psychiatric advance directive, and if you're like me, you have an advance directive. I do not want to be resuscitated beyond a certain point. Just let me go. And a psychiatric advance directive can be very simple, it can be complex. And it's a legal document, and they have to be able to have that, but it has to be on file with the doctor or with the hospital. But it's very similar to a advance directive. So what drug you want or don't want, what hospital you want to go to, the type of treatment that you're willing to agree to, all of that is already predetermined by the individual with help from either a trained facilitator or family. So that is one tool that can be used, but then it has to be in every hospital. And an awful lot of people travel between counties. And once you go out of county, your records in that county disappear. So all of this has to be improved in some way, shape, or form, but there's a lot of privacy issues, there's a lot of security issues with a lot of that. They're hacking the big corporations who have the best security in the world. So can they do it? Yes. But there's going to be that risk. You had a question?
Yeah, mine was a follow-up to the man that was trapped in his mom's body
I finally got out
for obviously no more than 3 months. Anyway, the question was, with Sacramento doing so much overreach, with the government now, I would think, is there a movement, is there a lobby group with NAMI or with group up in Sacramento to do what you were saying, to have a database, not just county to county, but statewide?
There's discussion, but like I said, you run into a lot of privacy issues. And one of the other issues that you run into is the human autonomy movement. So when you're talking about having someone get involuntary care. There's an awful lot of people who have what they call anosognosia. Anosognosia, either you don't recognize or you don't want to recognize your illness. And I mean, you got to remember, this is an issue of self-esteem in a lot of cases too. So I'm a cripple. I don't want to admit I'm a cripple. I'm a mental health patient. I don't want to admit that I have a mental health illness. So you run into a lot of that as well. So you have that fine line between someone lying in the street in the pouring rain in their feces and getting them involuntarily into a hospital for care, and then stabilizing them and hopefully getting them on the right drug so that they can be stabilized and they can start making rational decisions again. But that runs straight up against the human rights groups, disability rights, the ACLU, people like that. So they're all for complete human autonomy. Well, we know, because mental illness is terribly debilitating. We see it every day on the street. Do these people really have the freedom to be out there on the street, not caring for themselves, dying of starvation, dying of diabetes, dying of overdose, whatever it may be? When is the point of intervention allowed? And that is way beyond my pay grade.
Is there cooperation between the government? You got $300 million sitting there, get all the money in the world, and then you have churches who are trying to feed the homeless and trying to do all these good, wonderful things, great intentions. Is there any bringing it together? Something I have talked to.
Well, the separation of church and state is a fact. We can't really do too much in that respect. But what they can do is training. What they can do is facilitation. What they can do is to possibly co-locate nurses. Hoag Hospital, as an example, is now paying for parish nurses in different faith communities. So they're actually supporting financially to have these nurses in those locations on a church campus or a synagogue or whatever. But that's their thing. They were ordered by Kamala Harris, if you recall, when Providence bought a lot of the hospitals here in Orange County. They were ordered to spend $10 million, or it was 10 or 110, on local mental health care, and that also includes physical health as well. So there is some of that money around. There's a lot of different money. There's all sorts of revenue streams that come into this, and again, those revenue streams have to first be understood, and what the limitations of each of those revenue streams are, and then on top of that, we have to figure out how to blend them. Now, it's a bit of a model because they had money come in from the hospitals, they had money come in from CalOptima, the insurance company for Medicaid, and they had money come in from the county mental health budget. So we're building another campus down in Irvine, right across from the train station on county land. That's going to be 22 acres, which, by the way, is the exact size that I had proposed for the Fairview proposal in 2016. And they're not telling anybody really what they're going to have in the way of services yet. They're being very broad stroke, and they have to get more specific. And they have to do a needs assessment more than anything. And that's one of the things that bugs me. I'm a manager. I'm in the electronics industry. We work on numbers. We work on statistics. We work on gap analysis, all of these different things, and I don't see them doing that. A lot of it is run by clinicians. They're great at what they do, but they're not managers. They're not planners. So you have to have that element to be able to do that, to know what the needs are. And they're building this 22-acre campus. It's going to cost about $120 million. And what is it going to accomplish? What is the need? What are the levels of beds? Because you need locked beds, you need unlocked beds, you need group homes, you need permanent supportive housing. All of those are needs in the continuum of care. But we don't know what we're getting. They know, but they're not sharing.
Is Fairview shuttered? I mean, is that facility still available?
That is one of the great real estate prizes in the state of California. And basically it became so political because you had the NIMBY element, not in my backyard, even though it's been a developmental hospital since 1962. And, and it would be secluded. It's an isolated part of the city because there's a lot of parkland around it. There's a golf course around it. So it could be a standalone, but it's owned by the state, and the real estate developers have been licking their lips at that one for years, and we don't know what's going to happen. So that just came off the table. I mean, the city of Costa Mesa, I got yelled at by Katrina Foley for bringing the proposal up. So, you know, how dare you? And I said, I've been working with your people for the past 3 months, and she's a politician, so they don't understand.
Prostitutions are prostitutions.
Yeah, but basically we need those facilities, but we need them at each different level. We need to have an overarching plan, which we don't have. So a lot of good things are happening, but they're happening in a vacuum. Yes, sir.
Be Well is a 501c3.
Yes, it is. It's actually, the corporation is called Mind OC. The movement, if you call it that, is Be Well. It's you know, there's not a lot of transparency there. So it's a 501c3. They run the campus. The county owns the building, and it's got a, I don't know, 60-year lease, 90-year lease, something like that. But it's a long-term project, and the county is funding parts of it. And a lot of it is for patients who have Medi-Cal. So there was supposed to be a payer-agnostic environment there, and they have not got that sorted out either, because there's an awful lot of private insurance money. We need facilities where you can just go and know you're going to get care. You shouldn't have to worry about which insurance provider you have, whether you have an HMO, PPO, or Medi-Cal, whatever it may be. And that's really what you need when people are in crisis.